Hi, this is Claudine Cloutier. I am Benefits Program Manager for the county, and this is our Open Enrollment Info Session presentation. This is exactly the same presentation that you would have seen if you had attended a live session. So I hope you find it interesting and helpful, and we will start talking about what open enrollment is, and then we'll move into more information about the plans and how you can compare them. All right, so the very first question is, why should I care about open enrollment? Well, open enrollment is a really important time in the benefits world because it's the one time that you can make any change you want to your medical or dental plan or enroll in an FSA contract. So FSA contracts don't roll from year to year, so you have to enroll in one annually if you want to participate. So it's also a good time for you to review all of your benefits, to look at the information in the open enrollment site just to make sure that your dependent information like dates of birth and social security numbers are correct, because we are required to report that information to the IRS. So open enrollment is available online only, and it started August 1st and it will end on August 17th at midnight. So please don't wait till the last minute to go into the system. Please make sure you go in at least a few days before to make sure you can get in, to get answers to any questions you might have, because once it closes on August 17th, we're done with open enrollment, and then the only time you can make changes to your medical, dental, or FSA plan is during the next open enrollment or as a result of a qualifying event that allows you to make changes. So it's a good time also to look at other elections that you might have, your life insurance, do you have long-term disability coverage, are you saving enough for retirement? Open enrollment is just a great time to think of all these things, and then once you've done that and spent the time looking at your options, you're done for the year and you don't have to worry about it again. So it's really important that you pay attention to your open enrollment period and make changes that you need to during that time. Here is a high-level summary, side-by-side summary of the plans. We're going to go into detail in further slides, but the Albemarle Select plan is a traditional health insurance plan. It features copays for doctor's visits and pharmacy. It has deductibles for non-copay based services, and once you meet the deductible, the plan picks up at 80% and you pay 20% of the allowable charges until you reach an out-of-pocket max. The out-of-pocket max is kind of like your safety net on the insurance plan. It keeps you from spending tens or hundreds of thousands of dollars on healthcare expenses. So once you meet the out-of-pocket max during the year, if you meet it, you can expect the plan to pick up at 100%, and you won't pay any more until the plan resets at the start of the next plan year. There's 100% coverage for preventative services. Preventative services are things like your annual physical or screening exams like colonoscopies, mammography, pap smears, those kind of things. So the high deductible plan also has deductibles, but you might imagine that they are higher because it's called a high deductible plan, and you'd be right about that. There are no copays until you meet the deductible on the high deductible plan. So what might be a $25 doctor's visit on the Select plan might be an $85 doctor's visit on the Choice plan. So you pay the allowable charge for whatever the visit or service or drug costs, and then those expenses go towards your deductible. Once you hit your deductible, the plan picks up at 100% with the exception of pharmacy. Pharmacy, once you hit your deductible, actually goes to copays for as much as $1,000 individual or $2,000 family, but then at that point you're limited, and you also have an out-of-pocket max as well. Again, 100% coverage for preventative service, so regardless of which plan you pick, those screening exams will be absolutely free to you. Included with the high deductible plan is something called an HSA or health savings account. For people selecting the Albemarle Choice plan, if they're full-time, they'll receive $1,104 into their HSA account. We'll contribute that automatically, and we'll set you up with it automatically. The $1,104 is given to you in two buckets, half at the end of October and half at the end of April. Since you're likely already familiar with traditional insurance plans, we're going to spend a little more time on the high deductible plan to help you understand it better. So as we said earlier, a high deductible health plan has higher deductibles, but that equals lower monthly premiums to you. Premiums are the amount of money you pay per month to participate on the plan. So with a high deductible plan, you do have higher deductibles, but you have lower premiums. All covered expenses are paid out of pocket until the deductible is met. So again, that means that there aren't co-pays on the high deductible plan until you meet your deductible. You're going to pay the allowable charge or no more than the allowable charge for any given service, for drugs, etc., until you meet your deductible. Remember that the high deductible plan still has negotiated network discounts built into it, so you get the same kinds of discounts that you would get under the traditional plan. So preventative care, again, is covered at 100% under either plan. So there's no excuse not to get your screening exams, your annual physicals, and that kind of thing, because you don't have to pay for it. Now, the high deductible plan is really a great plan for people that are willing to do a little shopping, because savvy consumers save money. Now, I would argue, because we have deductibles and co-insurance on the other plan, that shopping around, regardless of whether you're on the select plan or the choice plan, is a good idea, because if you're going to be paying a percentage of a cost, you want the cost to be as low as possible. So that's the high deductible plan. And with the high deductible health plan comes the HSA, or health savings account. Now, the health savings account is an account that's tax favored. You put funds in on a pre-tax basis, and then you pull the funds out of your HSA, very similarly to an FSA. You pull the funds out to meet your higher expenses on the high deductible health plan. The beauty of an HSA is that both you and the employer can contribute toward the HSA. And as we said on previously, there is a 1104 employer contribution into your HSA as part of membership on the high deductible plan. So one of the things that's really interesting about HSAs is that all the funds belong to you, both the employer and any contributions that you might make. And they're really meant to do two things. One is to meet your higher expenses under the high deductible health plan, but the other is to help you save for future retiree health care costs. This plan is triple tax advantaged. Your money goes in pre-tax. As long as you use it for eligible expenses, you're not taxed on the money when you use it to pay for your expenses. And then as you invest it and it grows in value, you're not taxed on the earnings of that income as long as you're using it for eligible expenses. So it's really a great way to prepare for future retiree health care costs. But those funds are yours when you walk away from county employment, and you'll be able to use them at a future time. If you decide to stop using the high deductible plan and move over to the traditional plan again some point in the future, you'd still have access to the HSA funds to pay for your expenses, but you wouldn't be able to contribute anymore. This has unlimited carryover. Again, the government wants you to save for retirement, so they don't cap how much you can have in your HSA, but they do cap how much you can put into your HSA in a given year. All right, here's a chance for you to see how the high deductible health plan and the HSA work together. Our figure starts the beginning of the year with an employer contribution into his HSA, and hopefully he's putting some money into his HSA as well. He'll use the funds in that HSA, or health savings account, to pay for any eligible expenses he might incur in the plan. Maybe he has a doctor's visit, maybe he has to fill a prescription. So once he meets his deductible, if he has expenses enough to meet his deductible, now there's a kind of a zone in between I call copay land for the high deductible plan. So if he meets his deductible and he still continues to have pharmacy costs, he goes into copay land for the pharmacy only. So he'll pay copays for drugs to a maximum of $1,000 individual or $2,000 family. Once he does that, he'll meet his out-of-pocket max, and then he's done for the year. Remember that the out-of-pocket max is the safety net for the plan. That's the limiting point where you don't have to pay any more out-of-pocket if you or your family have a really bad medical year. So let's go back to that deductible. Let's pretend this guy gets to his deductible and he has no pharmacy costs at all for the rest of the plan year. Well, if that's the case, then once he meets the deductible, he doesn't have to pay anything more for any kind of services that he has for the rest of the plan year. That could be surgeries, it could be tests. He's done because he's met his deductible, which in this case would end up being the same as the out-of-pocket max. So if you understand this part, this is the most tricky thing I'm going to explain to you during this presentation. So take a moment to really look at that and understand it. And if you have any questions at all, don't hesitate to contact us for clarification. So remember that at the end of a plan year, our deductibles and out-of-pocket expenses reset. So when you start the new plan year, you start all over again to meet your deductibles and out-of-pocket max. All right, remember how I said that hopefully that our guy in the previous slide was saving on his own into his HSA? Here's some food for thought about funding your HSA. On the left, the pile of gold coins that's high is meant to represent the higher cost of healthcare premiums for the traditional or select insurance plan. In the middle, the lower pile of coins is meant to represent the lower premium that you pay to be on the high deductible health plan. The smart consumer will take the difference between what he would have paid on the traditional plan and what he is paying on the high deductible plan and put that into his or her own health savings account. So remember that the funds in your health savings account are yours. They're portable, you can take them with you, so it's your money. So why pay higher premiums when you can pay lower premiums and save that savings into your health savings account and then use it for future healthcare expenses and hopefully for even retiree healthcare savings. So remember that when you pay premiums for your health insurance, regardless of whether you're on the traditional plan or on the high deductible plan, you never get that money back. So why not take that savings and put it into your own health savings account? It's important to recognize that one size does not fit all when it comes to healthcare plans. What works for one person may not work for another. Traditional plans work for people who prefer to pay higher known costs that they can budget for, and those higher known costs are your monthly premiums. And they pay those higher premiums in order to pay lower out-of-pocket expenses when they have the unknown costs, which are going to the doctor or having a surgery or going in the hospital. People like the traditional insurance model because it's familiar. You pay a copay for drugs, you pay a copay for doctor's visits. So if that's your viewpoint on things, then the traditional plan is where you want to be. The high deductible plan is for someone who wants to pay the lower known costs, meaning lower monthly premiums, and is okay with paying higher out-of-pocket costs when they seek services. They're willing to manage their healthcare expenses. That means keeping track of receipts if they want to submit reimbursements for the HSA. It means maybe doing some research to find the best price on pharmacy or the best price on a medical exam like MRIs or CAT scans. And they're also willing to invest their premium savings to build their HSA to, one, meet their out-of-pocket costs during the year, but also to save for future retiree costs. So if that sounds more like the way you'd like to approach your health care, then the high deductible plan may be for you. All right, well, as I said earlier, one size does not fit all. So here are some potential disadvantages of the high deductible plan with a health savings account. It can be hard to accurately budget for expenses because you don't necessarily know what things are going to cost in advance. Now, information about the cost and quality of medical care can be difficult to find, but there are some resources. One, you can log into your Anthem.com account and look up a comparison tool, which are there to help you understand what the range of charges for a given service might be. There's also information on the web for pharmacy costs. GoodRx.com is a great resource to see what drugs in your area cost. You plug in your zip code and the name of the drug, and you can see what the local pharmacies are charging for that drug. There may be some big box stores, they call them, and those are the Walmart superstores or the Costco's that don't have their prices on GoodRx.com, but you can certainly pick up the phone and call those pharmacies to see what they're charging for a given drug. And I don't know about Sam's Club, but I do happen to know that you don't have to be a member of Costco to use the Costco pharmacy. I use them myself, and I think it's great. Some people may find it challenging to build their HSAs due to higher plan use. So if you're putting money in the HSA and you're spending money in the HSA, it can be hard to build a balance. So if you have a bad year, you may end up taking a bite out of your HSA balance. So this is a biggie. Some people may not seek medical care or take prescription drugs as needed in order to save money. So this is the part where I say, if that's you and you think you might do that, then please don't take the high deductible plan. We want you to take the medicines that you've been prescribed because we want you to be healthy, and we want you to seek medical treatment when you feel that you need it. So if you really feel like this would keep you from using your health care benefits when you need it, please don't take this plan. If you use your HSA funds for non-medical expenses, you may have to pay taxes and penalties on the funds that you use for non-eligible expenses, so you don't want to do that. Here are two really important things, so you have to look at who's on your plan and where they are in life. Your HSA funds cannot be used for the expenses of your children who are on the health care plan if they are no longer tax-eligible dependents. So remember that our insurance plans allow you to insure your children up until the age of 26. However, they stop being tax-eligible dependents much earlier than that, somewhere around 21 years old. So if you cannot claim your child as a dependent on your tax return, then you are no longer able to use your HSA funds for that child's healthcare expenses, even if the child is on your medical plan. So if that's you, you want to know this, you may choose the other plan because of it, or you just want to account for that. The other piece is if you or your spouse is enrolled in Medicare, you can't be in an HSA. So that is a somewhat complicated situation, and if you have questions about it, I would encourage you to contact our HSA vendor, which is Health Equity. You can reach them at www.healthequity.com, and their contact number is on their landing page. They are open 24/7, and their customer service reps would be happy to speak with you. So this is really important. Please remember these two qualifications on the HSA plan so that you can pick this plan and not worry about being in non-compliance with IRS rules. All right, so this is our second year offering the health savings plan with the high deductible health plan. And last year we surveyed the original group of participants just to see how they felt about the health plan and what their struggles were, what their questions were. So we got pretty good feedback on the high deductible plan. As you can see, a majority of folks surveyed believed that it was a good plan for them, and they liked the feature of the health savings account contribution from the employer. And we really had very few people that ended up leaving the plan to go over to the traditional plan. So all in all, it was a very successful first year. All right, now that you understand the differences between the plans, how do you really assess which medical plan is going to be best for you? So one of the things I like to remind people of is the fact that there is nothing covered on one plan that isn't also covered on the other. So you don't have to worry about making a mistake and not being able to use a service that might have been on one plan versus the other. Everything's the same in terms of what the plan covers. So think about this in the way that you think about car insurance. So you're going to set your deductible with car insurance, right? You're going to assess the premiums. You're going to assess what you pay out of pocket when you need to use your car insurance. So this really doesn't have to be any different than that. So remember that you want to compare your monthly premiums. You want to view the side-by-side highlights so you understand what you're responsible for out of pocket when you go and seek treatment or when you purchase medications. You want to think about how you and your family, your covered family members, actually use your health plan. Some people don't use the health plan very much at all, and others are more power users. So you want to think about what is true of your situation. And then finally, your out-of-pocket max. Remember that the out-of-pocket max is your safety net that keeps you from being economically devastated if you have a really serious bad medical year. So understand the out-of-pocket max and look at the differences between the two as you're assessing your options. All right, so let's look at a comparison of the plans Purely financially, what you're paying in premiums, health savings account contribution, etc. So at the employee-only level on the Select plan, that full-time employee is going to pay $86 a month to be on the health plan. If they have a child on the plan, then it's $129. If they're insuring their children or their spouse, it's $260 a month, and then family coverage is $330. On the Choice plan, it's $15 for employee only, $50 for employee plus child, $134 for employee plus children or spouse, and then $179 for family. That middle column is the premium difference between those two plans. So for example, the employee-only level, the difference between $86 and $15 is $71. So every month, the person on the Choice plan at the employee-only level is paying $71 less per month than that same person would be on the Select plan. Now, let's factor in the HSA contribution from the employer. Remember that I told you earlier that it was $1104 for the year? Well, if you divide that by 12, that's $92 a month. So if we add the premium savings of $71 together with the HSA contribution of $92, that person on the Choice plan is up by $163 a month versus the person who selected the Select plan. And then the person who's got employee plus child coverage is at $171 up on the Choice plan, and so on down the line. So this is purely the financials. This has not factored in what somebody might spend during the year as they use the health plan. But it gives you an example of the differences between your out-of-pocket costs in terms of premiums and factoring in the HSA. All right, now that we've compared premiums, let's compare out-of-pocket costs when you seek services. So the plan year deductibles are on the first line. So let's remind you what a deductible is. A deductible is an amount of money that you need to pay out of pocket before the plan kicks in at 100%. Now, on the Select plan, you pay co-pays for doctor's visits and pharmacy, so those don't apply to the deductible. The deductible would kick in if you had a hospitalization, an ER visit, a surgery, or any other kind of test that isn't copay based. So if you have one of those things, you're going to have to meet a $500 deductible before the plan will kick in. It will pick up 80% of the allowable charges, and then you would pay 20% to the plan year out-of-pocket maximum. At the individual level on the Select plan, that's $3,500, and on the family side of things, it's $7,000. So both the deductible and the out-of-pocket max are set at the individual level. So that means if one person in your family is particularly sick, they might have to meet that $500 deductible, and then at most they'll have for the course of the year is $3,500 out-of-pocket expenses until the plan resets the next year. So on the family side of things, at most for family coverage, regardless of how many people you might have in the plan, you'll be capped at a $1,000 deductible for the family on the Select plan, or $7,000 at the family level on the Select plan. It's important to note that these are set individually, so even if you have 10 people on your medical plan, you're not going to have to meet a $500 deductible for all 10 people. Or an out-of-pocket max of $3,500 for all 10 people. You're capped if you have a bad year at most $1,000 out-of-pocket or $7,000. Now the Choice plan, you can see the deductibles are much greater, and that's why they're called high deductible plans. At the individual level, the deductible is $3,000. At the family level, it's $6,000, so no more than $6,000 for a deductible, no matter how many people you have on that plan. And then the plan pays 100% once you meet that deductible. Remember that once you meet the deductible on the Choice plan, if you have pharmacy costs, then you will move into copay land for the pharmacy only to a maximum of $1,000 individually or $2,000 family, and that's why your out-of-pocket max is $4,000 or $8,000. So if you meet your deductible of $3,000, $6,000, and you don't have pharmacy costs, then you're done for the year. Remember again that preventative care, preventative exams, preventative drugs are covered at 100% regardless of which plan you're on. All right, next we have some scenarios to help you understand how the plans would pay out under a given scenario. So our first example is someone who is a new teacher, has no dependence on the health care plan, and doesn't even use the services that year other than a preventative annual screening exam. So on the Select plan, she would have paid $1,032 over the course of the year for Select plan premiums. She had zero out-of-pocket costs. She doesn't get an HSA contribution because she's on the Select traditional plan. And so her out-of-pocket costs for the year were just the premium she paid, which is $1,032. Now, if she had joined the Choice plan, the high deductible plan, she would have paid only $180 in premiums over the course of the year. We also gave her $1,104 into her HSA. So when you factor in the savings of the premiums, the difference between the $1,032 she would have paid on the Select plan and the $180 she did pay to be on the Choice plan, plus the HSA contribution, she's up almost $2,000 because she selected the Choice plan. Now, it's really interesting to note that in this scenario, if this person had been on the Choice plan for another year and we had exactly the same premiums and exactly the same employer contribution, and she had just no usage of the medical plan beside a annual physical, she would have enough in her plan to meet her $3,000 deductible after 2 years. Our next example is kind of a more typical example. So this person is a social worker with no dependence on the health plan, just like the previous slide participant, but he actually used a moderate amount of medical services throughout the year. So we have the same $1,032 for Select plan premiums over the course of the year, or $180 for the Choice plan premiums. His out-of-pocket costs on the Select plan for this year would have been $1,855. On the Choice plan, they would have been $3,911. So you see there's significant difference in the out-of-pocket costs on either plan. However, the county has given the employee on the Choice plan $1,104 into their HSA to help offset the cost of that higher deductible on that plan. So when we factor in the premium savings between the two plans and factor in the HSA contribution, Mike would have done a little bit better on the Select plan that year. He would have saved himself $100 out-of-pocket costs. Now, your plan experience is going to vary year by year, so maybe one year Mike had a better year than another year, and who's to say he wouldn't have done better on the high deductible plan on the next year. So this is an example of why you have to look at what you use the healthcare plan, or how you use the healthcare plan, when deciding between them. The next two examples are meant to show you what a worst-case scenario looks like on either plan at the individual level and then at the family level. So Michelle is an office associate who covers her spouse, and he's had a bad medical year, and he's going to hit the out-of-pocket max himself. Michelle's had a good year. She's been relatively healthy. So when we compare our premiums, that's always the first thing we want to do. What am I paying to be on this plan? So at employee plus spouse level, this couple paid $3,120 to be on the Select plan versus the $1,608 they would have paid to be on the Choice plan. Now, their out-of-pocket costs on the Select plan that year would have been $3,125. On the Choice plan, they would have been $10,120. But we have an out-of-pocket max, and so the out-of-pocket max on the Select plan is $3,500. On the Choice plan, it's $4,000. When we factor in the $1,104 employer contribution to the HSA and the difference between those premiums and the difference between the out-of-pocket max in the year, this couple is still ahead by over $2,000. And that really is a feature of lower premiums, caps on the out-of-pocket maxes that keep you from spending tens or hundreds of thousands of dollars on the health plan, and the HSA contribution. For our last example is an example of a family that hits the family out-of-pocket maximum. So Steve is a police officer that has family coverage. His wife and child were in a serious car accident, and both are fine now, but their medical expenses hit the family medical out-of-pocket maximum for the year. So same as in the previous examples, we look at the difference in the premiums between the Select and the Choice plan. We look at those out-of-pocket maxes and the differences between them. We factor in the HSA contribution that you get if you're on the Choice plan, and compare the annual out-of-pocket costs when we add all those things up together, and still this family's up by $1,900 by being in the high deductible health plan. All right, let's move on to a different subject, and that is the flexible spending account. If you're not familiar with flexible spending accounts, they're kind of similar to HSA, but they're kind of not. So a flexible spending account is an account that you use for reimbursable medical expenses or dependent care expenses. Now, when I say dependent care, I mean children under the age of 13. You can have a dependent care expense FSA account to pay for daycare expenses and after-school expenses. So medical FSA, you can use that for reimbursable medical expenses, and also that would include vision expenses and dental expenses. So the reason FSAs are great is that the money is deducted out of your paycheck on a pre-tax basis. It goes into your flexible spending account, and then you use the funds in the FSA to pay for those medical or dental or vision expenses. So FSAs give you more buying power with your money because the money is never taxed if you use them for eligible expenses. The money goes in on a pre-tax basis and you pay out on a non-tax basis, again, as long as you're using it for eligible expenses. It's really important to know the rules. We do feature a $500 rollover from one plan year to the other, so as long as you don't have more than $500 in your medical FSA from one year to the other, the amount will roll. It's really super important that you remember that you have to enroll annually in FSA contracts. Because if you don't, then your funds may roll over into the next year, but you won't be able to put in more. So remember, open enrollment time means FSA time too. Now, we're going to be having a short plan year this year in preparation for the move to calendar-based years for our FSA and medical and dental plans. So that means that we have to offer abbreviated contributions for the short plan year. For the medical FSA, at most you can put in for the short plan year is $883.32 for that September through December plan year. And when we have open enrollment in November for the new calendar-based year, you can set new elections into an FSA if you like. We have a $500 rollover from one plan year to the other, so as long as you have at or under $500 in your FSA when a new plan year starts, it will roll over into the new year. However, remember, you've got to elect a new FSA contract during open enrollment if you want to continue to put money into your FSA for the next year. The medical FSA comes with a convenient debit card, which is also called the Benny card here, but you can also submit for reimbursement of expenses that you might pay out of pocket. But I think you get the most bang for your buck if you use the debit card because the money went in there pre-tax and it's coming out after tax. Remember that, or learn that, with the choice plan, you don't have access to a regular medical FSA. We are offering a limited purpose FSA for people on the choice plan, and it's called limited purpose because you can only use the limited FSA funds for dental or vision expenses. So to recap with medical, if you don't have insurance here at all, you can still have an FSA here if you want. If you have the Albemarle Select plan, which is a traditional insurance plan, then you can elect the traditional medical FSA, which you can use for any kind of eligible expenses, medical, dental, and vision. Or if you're on the Albemarle Choice plan, then you're limited to the limited purpose FSA if you want an FSA in conjunction with your choice plan, and that purpose is limited to vision and dental expenses. There's one more advantage to having a medical FSA in addition to having that 30% more buying power based on the pre-tax nature of the contributions, and that is that the medical FSAs, both the limited purpose and the regular, are pre-funded at the start of the plan year. So in other words, if you go in and say, I would like $500 in my medical FSA for the coming year, when the plan year starts, you have $500 in your FSA account to use for your medical expenses. This is even if you haven't started making contributions into the new plan year. So I like FSAs for that reason. So if you have an unexpected large expense, like glasses, needing glasses, or dental work, it's already on there. So to be very clear, HSAs and FSAs are different in that regard. FSAs are preloaded at the beginning of the year, and I'm only talking about medical, not dependent care, because it's a different story there. And then HSAs are only have in them what you put into them and what the county put into them. So they're not preloaded in that way. All right, some things to remember. As we said on the previous slide, if you select the choice plan, which is the high deductible plan, you can only do a limited purpose medical FSA, which is limited to dental and vision expenses only, versus the regular medical FSA. I like the pre-funded nature of the FSA, and so I have the limited purpose FSA in addition to the choice plan and the HSA, because that way I can use my FSA funds for eligible dental and vision expenses and not use my HSA dollars for those expenses, and that helps me grow my HSA balance. Some people feel differently about it and they just like to use their HSA and not even have an FSA. And you're certainly welcome to do that as well. You can use your HSA dollars for medical, dental, vision, the same sort of things you could use your FSA for. So it just depends on your preferences. Be sure to understand your options. If you're going to opt into the high deductible plan, be sure how it works and that you understand that. Put money into your HSA if you're going to do that. The main source of unhappiness, I believe, with the HSA plan is that people just aren't prepared for those higher out-of-pocket costs when they seek services because they're so used to co-insurance or co-pays. So if you're prepared for those, the HSA plan, the high deductible plan, is really pretty simple when you use it. So just be sure that you understand the options and the limitations in terms of your covered dependents. Make sure that you can use your HSA funds for your covered dependents and that your spouse is not on Medicare if they're also on your health plan. You need to know where to go to get more information and research your options. And that's true of either plan. You can log into the anthem.com site to see what things cost. You can do an estimator. You can look back on your own medical usage and look at your EOBs. The EOBs are those documents that they send you after you've had services that tell you what the plan pays and what you pay. That can give you a good idea of what your medical costs have been and what they might be if you have a similar plan experience here. Be a smart consumer regardless of which plan you're on. While there's not really super great research tools available, there are some good ones that you can take advantage of now. We mentioned goodrx.com earlier. There's anthem.com. You can call to see if there's a difference in costs, because you really can save yourself some money if you do a little bit of research, because you might travel to Lynchburg or Richmond and save yourself several $100s on a test, and that might be worth driving to you. So the other piece to remind you of is that we are transitioning to a calendar year beginning January of 2019, and we're kind of in a transition period. So I'm telling everybody that the best way to get the best bang for your buck on the medical plan is to stay put. So whatever plan you have as of October 2018, stay on it through December of 2019, because our out-of-pocket maxes and deductibles are being set for a 12-month period, not the 15-month period. So you'll save yourself some money if you use the plan a lot that year. If you decide to change plans in January, then you're going to have to re-meet your out-of-pocket max and deductibles. They will reset. So decide what plan you want to be on now. Make your change during the current open enrollment period if you need to, and then plan to stay on the same health plan from October of 2018 through 2019 to maximize your healthcare dollars. All right, last slide. So remember that open enrollment closes midnight of August 17th, but please don't wait till the last minute to go on in and assess your options and make your elections. You want to give yourself time to make sure that you can get into the system easily. You want to be able to ask any questions that you might have and get answers. So I highly encourage you to go into the open enrollment system as soon as you can, and don't wait until the last minute so that you can get all of your questions answered. Please continue to read your benefits-focused newsletters throughout the year, certainly throughout the open enrollment period, but also throughout the year. After open enrollment closes, we pretty much don't send out benefit-focused newsletters unless there's really something important that you need to know about. So this is the way that I do it, and this is the way that you learn about these things. So please be sure to read them when you see them come across your inbox. During open enrollment, attending an info session is great. Now you've just kind of been in an info session. We do have one more scheduled for Tuesday the 14th at noontime, 11:30 to 12:30 in Lane Auditorium if you'd like to attend. You can visit our open enrollment information site, which is www.albemarle.org/open enrollment info, where you found this presentation. There's lots of information posted there for your use. And then to call us or email us at benefits@albemarle.org if you have any questions. All right, that's it for this presentation. Thank you so much for listening. I hope you found it helpful and useful, and happy open enrollment.